guys, Heather here. Well, the weekend's over and the weather was crazy. It was so friggin' hot. I'm scared because I'm supposed to go to Tucson in a few weeks and it's gonna be like 10 degrees hotter than it is here, so 110 or so. I'm totally freaked out. It makes me short of breath. Just kidding. Well, today's topic is, well, first we're gonna go to question of the day. So question of the day is, have you ever felt short of breath before? I know a couple of times I've actually lost my breath while exercising, where, you know, I kind of had a hard time catching my breath, and that was pretty scary. So I guess that was my moment for me, feeling short of breath. So have you guys ever had a moment where you felt short of breath, where you couldn't quite catch your breath? So that's today's topic. Patients with shortness of breath. How do you take care of a patient with shortness of breath? If your patient calls you into the room saying, "I'm short of breath, nurse," you know, they're all freaked out and panicked. So what do? You go in there, you check their oxygen. Well, first, actually, you want to run into the room and you want to take the pillow off of their face, right? Not really. So you want to check their oxygen, make sure, you know, if they're wearing oxygen, make sure it's on and attached and the patient's wearing it. Because a lot of times they'll take it off their face. Some patients don't like wearing oxygen, so they actually take it off. So then their SATs will drop, right? The O2 SATs, what measures the oxygen percent in the blood. So you want to check that, make sure it's normal. Usually above 95 is okay. Or 92. I think it depends on the hospital. My old hospital was 92, above 92. So that's acceptable. Unless they have chronic obstructive pulmonary disease, a lot of times, usually the O2 SAT is acceptable if it's 88 to 92, just because we don't want those patients getting too much oxygen for other reasons. Sometimes patients can feel short of breath when they're anxious. Some patients are on anti-anxiety meds at home, so if they have anti-anxiety meds, make sure that they get them. Sometimes patients will feel shortness of breath if they have pneumonia or asthma or fluid in the lungs. So if a patient has fluid in the lungs, if you hear fluid in the lungs, which are the little crackling noises when you listen to them with your stethoscope, then maybe check and make sure or see if they have Lasix ordered, and if not, might be a good idea to notify the doctor, so, you know, to see if he wants to order any Lasix. And if their SATs are below 92, not within normal limits, and raising the oxygen doesn't really help with the O2 SATs, then I would definitely give the doctor a call and let him know and see what he wants to do next. Breathing patients make nurses happy, right? So that's basically the initial response that you would do if a patient called you in with shortness of breath. Thank you everybody for watching. I'll see you Wednesday. Try and stay cool. Bye.